Hello and welcome to this video. In this video, we are going to discuss about increasing OVD in CR or CO and what are the benefits of increasing patients' OVD in CR or CO. So whenever we are doing full mouth reconstruction and we are thinking about increasing OVD to create restorative space, to lengthen the teeth, we have two choices. We can either increase the OVD in CO, which is the first point of contact, or CR, which is no contact, so there is no teeth apart position, so there is no influence of the teeth. So let's look at some of the differences between these two. So if you open patients in CO, it's well within patients' adaptive capability because patients already occluding in one point, and patients' muscles are stretched enough and they're used to going into that position. Whereas if you open patient in CR, there is a little bit uncertainty whether the patient will be able to cope with the open jaw and increase in OVD because it could be any opening in CR. So that's why many dentists, they prefer to restore patients in CO rather than CR, because if you restore patients with CO, you're less likely to come across TMJ problems or problems where patient cannot get used to with their bite. Also, if you restoring patient in CO, then you have a first point of contact as your reference point, which you can relate to when you're mounting model, when you're doing wax ups, and you're doing all the relative adjustments. Whereas if you're doing record patient in CR, you don't have any reference point apart from patient's CR position, which is repeatable position, but you don't have any teeth reference point because you're opening patients up because CR is a tooth apart position. The problem with CO is that you are limited how much opening you can do depending on where the first point of contact is. If patient's first point of contact is on particular tooth and patient has a huge vertical and horizontal slide, then you will have plenty of restorative space. But most of the time, the slide is between 1 to 2.5 millimeter. So if patient's got that much minimum slide, then you're restricted as to how much opening you can make and how much restorative space you can gain by restoring patient in CO. Whereas if you're restoring patient in CR, arguably you can open as much as you want. And studies shown that when you're restoring patient with teeth, it usually doesn't matter how much opening you're going to do. Patient usually can adapt quite easily. So you have a playing field, and you can open patients OVD according to your restorative needs. If you are restoring patient in CO, then you are relying on the fact that that CO is a natural CO and not because of the supra eruption of the tooth. Also, if the tooth is damaged or broken, patient's CO might be different than what patient's natural CO would have been if the tooth would have been intact. And that's why you're relying on that tooth a lot. And if patient's got supra erupted tooth, and if you started to restoring patient in CO, then you may sometimes can cause problems. Whereas the CR is tooth independent position, so it's independent to the tooth position. And that's why, again, you can start with the fresh, clean slate, and you can dictate kind of patient's occlusion from the scratch within limits, because sometimes teeth positions are not in an ideal place, and you may not be able to give the occlusion which you would want to unless you do orthodontic treatment. So there are pros and cons restoring CO and CR. The way I decide whether I'm going to restore patient in CO or CR is dictated by my restorative needs. If my restorative needs dictates that I need to open patient up more than what the CO is, then I would not hesitate but open patients up, because as I said, in general, you shouldn't have any issues. If you have ticked all the boxes and you've done treatment properly, then most of the patient, over 99% of the patient, get used to with the new position. Because remember, you would have done load testing, you would have done trial before you going ahead with the final treatment. And if patients got some TMJ issues, you would be able to recognize that before you're doing any irreversible treatment to patient. So I hope you found this video useful. If you have any questions, please feel free to contact me. I have a Facebook group called Full Mouth Reconstruction for GDPs. Please feel free to join the Facebook community so I can help you more and you can build a bigger and better community.